Good afternoon, everyone. I'm going to do a really quick update tonight because it's time for me to go eat dinner, but I want to get this done before that happens. And so let me show you a little bit more of the data. One of the things about doing the data is that I sort of have to check in on the data. So if the data is not setting a record, if the data is not the worst data ever, I'm still going to report on it. And in fact, we don't have the worst data ever. In fact, we have data that's actually looking pretty good by some of the measures that I've been looking at. And so I want to mention that hospitalizations, which I've been focusing on as the most reliable indicator of the three indicators that we have, they are dropping even more. And so I want to say that the second wave, that's not really a wave, is passing. What I have is there. You can see that this is where I was on August 10th, okay? I had technical difficulties there. But you can see that we were near the peak of a wave in the hospitalization nationally. That wave was happening in mostly different places from the places where the first wave had happened. And so I want to update that with the real data from just today, and you see that that decline has continued. We are not seeing a third wave by any stretch of the imagination. Instead, what we're seeing is everything's going down. Tests are going down the least. And cases are going down, hospitalizations are going down, and even deaths are starting to come down because they're lagging behind the hospitalizations and cases. If we zoom in on new tests and new cases by day, we can calculate the positivity rate, which turns out to be around 6% now, which used to be 8 to 9% nationwide. And this is a really good development. You can see that tests have sort of plateaued. They're sort of going flat, maybe dropping a little, but cases are dropping more. We're testing about the same, and we're seeing fewer cases. Again, this is in the aggregate 50 states, all very different nationwide, but it does mean something when you look at it over this long time scale, and this is good news. Hospitalizations is a flat line going straight down, and that's the really good news, and that implies that the new deaths that we're seeing are not going to go up from here. They should go down. And so, again, this is with the models that we have, and you can see that those deaths have been not going up or down. They've been pretty flat for a couple weeks. But now they're starting to drop off, and it looks like this trend will continue because they should follow the other two lines eventually. So what I want to do is I want to real quick show you the drop-down graphs. And once again, on these graphs, northeast is bad, down is good, and that's why I call them the drop-down graphs. Here's all the states that I'm looking at with the drop-down graph. The one thing I'm doing slightly differently from before is I'm now controlling each state for population. And so that means the number is a little bit weird, but you don't really need to know the number. You just need to know that the population that you have is, this is relative to population, which should be relative to healthcare capacity. This gives you an idea of how close the healthcare system is to being overloaded. And the one thing that I put on here that I haven't put on before is New York, because before it would have drowned out everything. Now we have New York, now that it's population corrected, it can serve as sort of the upper limit. We don't want hospitals to be as taxed as they were in New York. So what states came close to that overall? By the way, this is New York State, not New York City. So it's a little bit of an underestimate, possibly, of the ultimate healthcare capacity. But the main thing is, I don't want to get near that line. And if we're staying away from that line, we can at least say that New York City is not repeating itself. So see here, if you see all the states, I'm going to break this down in just a second, but if you look at all the states, you can see that Arizona is the one that came closest on a per capita basis to being like New York City. It looks like it came closer than it actually came. It came about half as close to New York City as the healthcare demand was that New York City presented. If you look at this, this is a logarithm scale on the sides of the graph. So all that means is, if anything, this underestimates or overestimates how bad Arizona was relative to New York. That's the worst that it was. Hopefully we don't have other states getting as bad. You can compare them, and you can look at here. The other states that were nearly as bad is Mississippi, which doesn't get a lot of press because it's not a very big state. The absolute numbers out of it aren't very big. But you can see that it's as bad as Arizona is. Thankfully, it is going down. The only thing that I have to report that I'm not entirely happy about with this, with the Mississippi line, which is the red and blue line for their college football team, it's coming down at a slower rate than I would like, and slower rate than the others. I'm not sure if this is an artifact of the graph, or if this is truly not coming down as quickly as it did in other places. But at the very least, it's coming down. You can see that Louisiana is also near there, and you can see Texas is the bright red behind there. But it's hard to see all these things going on, so I'm going to zoom in on the big states and then the small states. Here's the big states, and here you can see that they are all dropping. I've been reporting on these 4 problem states since July, and you can see that they've gone up, but now they've come down. Florida's line is a little bit weird, by the way, because they got into the hospital reporting game for current hospitalizations. They got into that late. It's like the one thing they didn't report. So they finally started reporting it, and that's why their line looks a little funny. The important thing is now that everyone's reporting, we have a good set of data from everyone. These should be roughly equivalent, and you can see that they are dropping. Arizona is dropping faster, but again, I think the main point to take away from this is all 4 of them are dropping. 4 very different states with different populations and different approaches. The only thing they have in common, with the exception of Arizona, is they're all really big. The other thing I'd like to show you, so I'll zoom in on the smaller states, and you can see there's Mississippi up there at the top again. You have Louisiana with its 2 big bounces. It's the best example of a twice-infected state. But again, remember I presented the argument that it's not being infected in the same counties again. It looks like if it hits one county hard, it won't hit that county hard a second time. That's actually a good indication. I hope that plays out, because that implies that everywhere that's been hit hard will have some sort of protection. Now, the nature of that protection is under debate. But for right now, I just want to report the hospitalizations and the bounces are going down. You can see that you have different trajectories for the different states. Down at the bottom, I want to point out with Washington, we have had sort of a second wave where it's gone up, hospitalizations, and then they've gone down again. And I'd like to point out Ohio has a similar kind of pattern. Look at those ups and downs. They even have the same kind of slopes. So I think it's interesting to compare Ohio and Washington and Louisiana as bouncing states. Michigan also has a little bounce. You see that at the end of Michigan. It's the blue and yellow, again, for its football team. It's bouncing up and down, and it's coming down. It's a much smaller bounce because they had a bigger outbreak earlier. Are these necessarily correlated? I don't know for sure, but I think it's interesting that the bigger the earlier bounce, the smaller the later bounce. And again, we don't have good data from the earlier part of the epidemic for the hospitalizations data, and that's one of the reasons why it's hard to get a handle on exactly how big the first bounce was. Georgia is another state that was in trouble, but its numbers were bigger because its population was bigger. And so you can see that Georgia actually looks like it's turning things around, and it looks like it hasn't taxed its healthcare capacity quite as much as Mississippi yet. Again, a lot of good news I'm seeing right here. It's hard for me to find a state where things are going up right now. I need to look closer at Hawaii and Missouri right now, but it's the fact that it's hard for me to find a state is the good news I'd like to report to you. So you can look closer at one of these, you can pause and look at it, but the thing I want to point out, these drops are happening nationwide in lots of different places, and they have lots of different policies and different approaches to this epidemic. I've always argued from the beginning that we need to make the response as local as possible. Nationwide responses don't necessarily work for a big heterogeneous nation like ours. With a virus that doesn't know how big our nation is, it just knows that there's someone it can infect over there. So the emphasis, of course, is on top-down legal restrictions, which certainly have an effect. But I want to caution you against saying, oh, it's because we had these top-down legal restrictions in Arizona that made it drop. If that's the case, we should have the same timeline for California, for Florida, for Texas. And the only thing I can say is when we looked at this in places like Louisiana, it's not very clear that the top-down is the most important thing. In fact, it looks like bottom-up social behavior. maybe the most important thing. People know people who are getting sick, they hear about it, and then they curtail their own behavior of their own accord. That's another piece to this puzzle. And then there's also all the physical things like geography, biological immunity that I've talked about, the potential cross-reactivity. And notice that those don't always prevent infections, but they may prevent severity. I say this as a T-cell scientist, okay? I've got to say that about T-cells. Don't say that T-cells aren't doing anything just because they aren't preventing infections. That's not what they do. Don't expect them to completely save us either. Basically, we're going to need to get all of these things working together if we're going to do it. Top-down restrictions are one part of the puzzle. But when we talk about those, we can't talk about them as if they're the only thing going on. In fact, there's a large role to randomness. I've got a couple of tweets I could show you from the scientists that are talking about, if you look at these two places, you'd think that they'd follow the same road, and one follows this road, one follows that road, and I can't find a reason for it. Be very skeptical of people who find a reason at this point. We need to have some kind of epistemological humility, if I want to get philosophical for a second. And the thing I want to say, these data updates are about the data, not about the data interpretation. The data are good. The waves are breaking and they are going down. So I was reminded of something by this article right here, because this is a point that I'd like to make. When we talk about top-down or bottom-up effects on this, we minimize the part of the random nature of infection, and we start to moralize. We say that, oh, those people were good because they did a bottom-up and they stopped the spread. And again, you can certainly do that. That's certainly part of the puzzle, but it's only part. And how much of a part is it? We need to look at the data and compare different places. When I compare those places, Florida and California have very different approaches to this epidemic. And yet they are both dropping. I'm going to take that as good news, even if I don't know why. So what I'm going to report on here is the what rather than the why. Realize that with cases like cancer, there are things you can do to prevent cancer. But then you can do everything to prevent cancer. My pastor, his father got lung cancer, and everybody assumed that he was a smoker. And he got it because he was a smoker. And I believe he never smoked a day in his life. Lung cancer does not only happen because somebody was morally bad and smoked a pack of cigarettes a day. There's a random element to it, as well as the predictable moral element to it. So we've got to say we shouldn't reason backwards. We're but like Job's friends. If we reason backwards and say, oh, this state is struggling with the virus, it must be because they aren't wearing masks, because they aren't following our rules. That may be part of it. But realize when you reduce it to that one thing and you start to blame them, you start to be Job's friends, rather than sitting in solidarity with Job and just trying to see when is this wave going to break. So I'm not going to point any fingers here. What I'm going to say is I'm saying that the data are that the wave is breaking, and right now I'm actually fairly optimistic. I'm worried about November because respiratory viruses always come back in November. But for right now, I'm actually optimistic nationwide that we're going to have a couple of months of some kind of reprieve from this virus. So thanks for listening. Please go ahead and take a look at the data. And if you want me to look at another state in more detail, I'm happy to do that. Just let me know. Now it's time for me to eat dinner.